So when you do that, now all of a sudden you can increase your income and have less headaches, less problem. When you're trying to run a practice, whether it's a chiropractic practice or a medical practice or a physical therapy practice, bringing patients in is volume, and getting them to follow their care plan is retention. So in the old days, it used to be volume was the answer. So you bring people in and you get more and more people to come in and get adjusted, and that's what chiropractors are doing, and that's how they made money. But insurances were paying for it back then. Now there's a lot of states where insurances are barely paying for it. The co-payments are way higher than the benefit. So you have to be able to collect cash. So to bring these patients in, to bring that volume in, you got to remember, you have a business and you're selling a product, and it doesn't matter whether insurance covers it or not. If you were selling widgets, I'm sure the widget maker isn't going to depend upon insurance to cover it. The widget maker is going to say, if I make it well enough or good enough, they'll sell themselves. And that's the same philosophy here. You want to bring in more patients. The best way to do that is referral, because when you get people well, it helps others to have confidence in your company and in your services. So when you do that, now all of a sudden you can increase your income and have less headaches, less problem. You can bring new patients in. If you don't know how to handle them when they get there, if you don't have an orchestrated system, especially if you have staff that are helping you process this patient, what the patient's looking for is, do these people know what they're doing? I'm not going to trust my health to anybody. If they seem like a bunch of bumbling idiots, I'm not going to become a patient here. There's some studies that say 60% of new patients never return to the doctor for the follow-up. That's not good. So if you want to have a higher return, you better have it orchestrated as to what you're doing and who's responsible for what, and everybody knows their job. So when I would go into my clinics, which I'd fly in or drive in, because I didn't live in the same state, a lot of times I would be there just to help them train. Training is a huge part of getting these systems to be seamless so that the patients don't see that it's actually a rehearsed or practiced thing. Comments I'd get from patients when I go into the clinic and they'd meet me, they'd go, "Oh, you're the owner. Where did you ever get this great staff? They really are so wonderful. They all know what I'm here for. They all understand what I'm trying to do, and they're all willing to help me do it." Well, that just doesn't happen by accident. There's a lot of work that goes into that. That work is training. That work is having systems written first, and then knowing the systems work, and then training to get the systems implemented. So there's a idea here of how you implement something. So you have to innovate, means come up with a new idea. Then you have to implement, put it in place. Then you have to quantify, you have to measure, is it actually doing what you wanted it to do? And then you have to re-innovate. That's how systems evolve over time. Our system that we're working with now started 35 years ago. So they've innovated over time to adapt to the changing environment, so we could deliver better care for our patients, have a more profitable clinic, and better outcomes for the patients. So then when you get a patient under that care plan and you're helping them, it's going to take repeated treatments. Some people say, "I don't believe in care plans." Well, that's somebody who's focused on the symptom. And the symptom is the most unreliable way to judge somebody's health. Men and women do not have the same pain tolerance. Women have a higher pain tolerance than men because they have babies. So to judge people based on their symptoms is the most unjust thing or unreliable thing you could do. You need to actually have a way to measure to get people well. And so what will happen is when that symptom goes away, because it is the first thing to go away, their tendency for them to want to quit care goes up, and then retention goes down. So by having systems on how to help keep people engaged and realize what they're trying to do is to fix the problem, not just get rid of the symptom. When they realize that, and they realize they're getting to be able to do things that they haven't been able to do for years, and they will actually get quality of life back, there's a hurdle there, and we help you through that. AMI's systems are designed to help patients realize, oh, there's going to be more than just getting me out of pain. They're actually going to try to fix things, and maybe abilities I've lost over the years that I just thought was because I'm getting old will come back. Now you have a patient who's going to stick it out. That's true with any care plan. Patient's very engaged in the beginning, get rid of the symptoms, then they're disengaged. You have to have a way to get them re-engaged and get them to realize, I am not here to just get rid of my pain. I'm here to get rid of this problem so it doesn't come back and I don't have a life with a bad back or a bad knee or a bad shoulder. When a patient gets to that point, then you see them get very engaged. going all the way to the end of their care plan, one of the things we hear most commonly from our patients is, do I have to leave? I really like coming here, which is a strange phenomenon that you would never experience unless you actually had care plans in place and a way to keep the retention up. AMI helps you to do that so you can experience the same thing. Getting those patients, when they get to the end of the road and they realize, I am way different and way better than I was when I started, better than I ever imagined I would be. I didn't even dream of having these abilities back, and now I have them back. That is going to be a tremendous referral source for your business. And the referrals you'll get will be, just go in and do what they tell you to do, because I'm telling you, you're going to end up way better than you expect. Now you have patients coming in that are not giving you a hard time and they're very, very compliant. Your volume goes up, your retention goes up, and it becomes a very, very happy place for everybody. Patients get well, patients follow care plans, they appreciate what you're doing for them, they refer more people, your staff is having productivity, which makes everybody happy, and the clinic is making a profit, which makes you and all your staff happy as well, because you all get paid and you have a career.